Welcome to the Health Services Career Panel. My name is Erica Warren, and we've lined up some amazing panelists today to talk to you about their careers in health services. When we think about careers in health services, we often think about doctors and nurses, but there is so much more to explore in this career field. So today, we're going to learn about some interesting opportunities that you might not be aware of. But first, let me introduce our host. Today's host is Mario Lopez. Mario was the 2020-2021 Pacific Region Youth of the Year. He attends the University of California, Berkeley, and is studying molecular and cell biology to eventually become a neurologist. His experience and interests are the perfect match for this health services career panel. Now I'm going to hand it off to Mario to introduce our panelists, and then we'll jump into a conversation to help us all learn about these exciting careers.
Hello, everyone. My name, like Erica said, my name is Mario, and today I'm very excited to learn more about careers in healthcare, their own experiences, what led them to where they are now. Elise had over a decade of nurse experiences. She's worked as a nurse extern, a neonatal ICU nurse, a pediatric registered nurse, an RN supervisor, and a health employee RN. In her current role, she performs occupational health screenings for new and current employees. Along with that, Elise received her BS in nursing from Mercer University, and as well as a Bachelor in Science and Biology Science from Georgia State University in 2009. Elise, we're so excited to have you. Can you tell us a bit about your journey and how you started off your career in nursing? And more curiously, after doing all these trainings and different types of nursing, is there a reason you keep coming back to nursing as your profession?
So my career started off a little unconventional. I actually was pursuing a medical degree. So I went to school initially to I wanted to be a family physician. When I got into college and I started doing the studies, I knew that wasn't really for me. So I changed my career path and I pursued nursing instead. I've always had a passion for wanting to care for individuals. And so I changed and thought that would be a way to still have that ability to care for others. I started working as a patient care tech or certified nurse assistant and started working in a couple different types of environments. I did an ICU, I did a nursing home. And once I got into nursing school, I kind of was able to narrow down where I wanted to work. So once I graduated, I knew I wanted to go into pediatrics. And so I landed my first job in a NICU and I loved it. And then once I started having a family of my own, I knew I needed to move to the outpatient setting. So I moved into peds, and now I'm currently working as a nurse supervisor. And that I wanted to pursue a leadership position so that I could kind of be that compassionate manager that I felt like I never had. And so I changed careers a lot because it was really about moving up into this leadership position. So that's what keeps coming me back, is the ability to just care for others. And now I'm caring for staff members instead of patients. So that, when they need a listening ear or they need some flexibility in their schedule, I've been in those positions before as a RN, that now I'm able to provide that compassion towards staff members. The biggest value I find is work-life balance. And if staff feels like they're being taken care of, then I know that they're going to work hard and come back to work every day.
Says, what do you think is most important to you in choosing and staying with that career path?
So the biggest priority for me is work-life balance. I have done the 12-hour shift life for a couple of years. About 6 of my 13 years in healthcare were 12-hour shifts. And I felt like it did not allow me the ability to be at home with my family. I missed a lot of holidays. Christmas was a big one that I worked very often. And I just knew I wanted to be at home a lot more. So I am in the outpatient setting. So I work a typical 9 to 5-ish kind of job, Monday through Friday. And it allows me the ability to be at home with my family, to pick up my kids from school, drop them off at school, And those are some big things that I find valuable.
I know you mentioned, Elise, you work in an outpatient unit. So what is outpatient and how does that differ from inpatient? And how does that kind of differ the routine of care that you have for patients? And is one necessary over the other? Does one bring more value or more skills? And how do those differ? And I guess it's a long question, but how did you choose to know that outpatient was the right unit for you and that way of lifestyle?
So the biggest difference between inpatient and outpatient is inpatient is going to be your hospital stays. So whenever there's a long-term stay for a patient, or even an overnight stay, a patient stays overnight. Outpatient is more of your doctor's offices. So your specialty doctor's offices. So you could have a cardiac doctor, a primary care doctor, a GI doctor. I'm currently in ear, nose, and throat. There's a lot of different, pretty much anything you see in inpatient, there is an outpatient office for that. And so the skill set, the only really big difference is that you're not spending 12 hours with a patient. It is a quick, 30-minute or an hour-long visit that you see them. So you kind of have to compact your care within that short time frame. And a lot of that care is actually the doctor. So, you see your nurse for a short time. They come in, do your vital signs and, see why you're here for the visit, that kind of stuff, go over any signs and symptoms that you may have, whereas the doctor does the bulk of the work in that visit. Whereas in inpatient care, the nurse is doing a lot of that work. So the nurse is giving your meds, the nurse is, going over your care plan, and the doctor pretty much comes in, sees what's going on, and is in and out. So the outpatient world I knew was best for me because it allowed me the ability to move into leadership a lot quicker. It's a little bit harder in an inpatient world. You just have a lot more nurses to kind of fight against to move into that role. In the outpatient world, I was able to utilize the experience I had, plus obtaining some certifications. I was able to basically apply and get the job pretty quickly. Whereas when I was trying that in inpatient, I was competing with other people. And so skill-wise, having all the skills that you learn in inpatient is actually very helpful in the outpatient world. Not that it happens often, but every now and then you do get, your emergencies. Last week I had a patient fall, and having that inpatient knowledge helps me to be able to take care of that patient in that moment.
But was there ever a day or a moment where you got out of your shift and you realized, yeah, this is the right career, and I'm really happy I stuck through it? And what lesson did you learn from that day, or just the feeling it brought to you, knowing that you are making a difference and doing so much to help not only the patient, but the hospital staff and everyone around you?
I think the moment that made me realize that this was the career for me was working in the NICU and watching the babies grow up and what we call them graduate out of the NICU and be able to transfer home was the biggest thing that told me this was the career and I made the right choice. It was great to be able to bond with the families and be able to kind of assist them in that, after hospital care that they were going to need. I've also had moments where I've bonded one-on-one with patients, just over the years. To me, I look at my life and I know that I'm a very compassionate person and I just don't see myself anywhere else. So it's very hard for me to picture myself anywhere. I've been in this career since 2010. So at this point, I could not see myself going anywhere else. I really, truly love this field and I just enjoy being there for others.